These could be the corner of my living room lectures, couldn't they? Well, lectures, I hate that word, but they could be the corner of my living room talks. That's better, isn't it? I'm on a mission today. So I wanted to record this video to talk about discs. All right, so I get lots of people who have been told that they've had an MRI scan and they've got degenerative discs and they need to be careful. Careful of what? Careful what? Bending, moving, twisting, reaching, lifting, pulling, pushing, breathing. I mean, it's such a casual statement, isn't it? Be careful. And then they leave you to it. And then, sadly, you know, you get to your physiotherapist and it does vary. It does depend. There's some fantastic physios, both in the NHS and the private sector. All right, and there's some not so good ones. It's the same in any profession. Okay, don't think that they're better because they're NHS, or don't think that they're better because they're private. Lots of us work in both sectors. Lots of us work in both jobs. It's the individual that matters and that counts, not the environment in which they work. All right. And so I'm going to share you this disc thing. So I'm going to show you, I've got some, if I look down on the floor, it's because I've got some models. Woohoo! There you go. That's the spine. Just obviously a segment of a spine. So that's the front, the bit in your tummy muscles. And this bit at the back, they're the spinous processes. They're the bits that you can feel when you touch your back. All right. In the middle, that's a disc. That's a disc. And these are the nerves. Lots of people have heard of the sciatic nerve. So can you see how it comes out between the joints of the spine? This is the side of your spine now. And can you see how the nerve sits in the middle? Obviously, these is just a model. You've got muscles, ligaments, the capsules of the joint, all sorts of things that sit around here. All right, so that's what happens. And what happen is when you bend, push and pull and lift, the muscles at the front of your tummy, your deep spinal support muscles, transverse abdominals, the internal obliques, they work at the front of your body, along with multifidus, which goes from one vertebra to another here at the back of your body. And what they do is they provide dynamic support. So that means when you lift something and then bend, all right, or reach or twist, these muscles switch on to allow movement at each segment. So it's not stiffening you so you can't move, but what they do is their job is to maintain this space where the nerve sits and all the other structures sit, blood vessels and things. So you don't put pressure on it. That's their job. All right. Underneath that, you've got the hips. So they're your muscles that provide stability when you're walking, and their job is to stop your spine doing this when you're moving, walking side to side. Walking involves twisting and forwards backwards movements. It doesn't involve side to side movements. So obviously, if I saw someone, just as a side issue, that had maybe muscles that could do with being a bit stronger or better behaved, if you like, on the pelvis and the hips, then I would work on that, because that would immediately affect your back. But anyway, I digress. So these muscles deep inside your spine, they're local stability muscles. Okay, people sometimes refer to them as core muscles. Sounds like an apple core. I'm not very keen on that term, but anyway, that's what I'm talking about, the same thing. Now, if I tip my spine up, you can see the spinal cord in the middle there. Okay, all right, you can see it's got space. And then here, this is the disc and this is the central nucleus. I don't like these models because your body doesn't really look like this. It's just a representation. I don't think it's a brilliant representation, but it's what I've got in the house. So you can see here that these fibrous rings are very close together, and they're very, very robust. Okay, they can withstand a lot of force. Inside, okay, all it is that the fibers are not quite so tightly knitted together, and you've got a higher water content. That's the only difference between them. Now, when you bend and twist, the discs deform, all right, to allow movement of the spine. That's their jobs, okay, along with managing forces, which is, I think, is quite a big concept to get your head around. And I'm pretty good with understanding, you know, movement forces and levers. But basically what happens is, it's even I can't get my head 100% around it, but what basically happens is that when you push, pull and lift, obviously this has to deform so that the forces are spread all along the spine into the foot or out through the arm. Okay, I'll give you a really simple example. If you bend backwards and you've got a stiff few joints here and a very mobile joint here, you will get less movement through the stiff bits and loads of movement through the more mobile segment. All right, so the muscles really help with that. They help with managing those forces so that you don't keep stressing one joint or one nerve. Okay, that's their job. Now, degenerative discs, okay, happen naturally as we get older. Our discs get thinner as we get older. Have I got a model to just show you getting a bit thinner? Yeah, okay. So you can see here it's just a bit thinner. All right, that's natural as we get older. All right, you know, it's the same as anything. Does it mean that it's dangerous? No. And the thing is that if we lined up 100 people and put them in an MRI scanner, you'd have a huge percentage of those that are showing degenerative changes. And the thing that I really need to explain is that if you go to a doctor or a physio or whatever, and you've got loads of leg pain and they've scanned you and to see whether basically the disc here is pressing on the nerve, and they see on a scan that yes it is, but you're not a surgical candidate, because vast majority of people are not. We don't do surgery anywhere near as much as we did do, and the reason that was because the outcomes after 5 years are just the same as conservative, which is non-surgical intervention, which is general being active, more exercise, maybe seeing a physio. All right, but that doesn't take away from the fact that you've got leg pain right now and it hurts. I get that. All right, so I know, because I've been there, I've had all of this, I've had a scan, got the same thing, so I do understand from a very personal point of view how debilitating it is, and how, honestly, how depressing it is when no one seems to be giving you any answers or helping you. Now, so degenerative means worn, but yes, you can get degenerative disc disease, which narrows the space here. So if you see, you can imagine, if I got one here, again, I hate these models, but if it gives you an idea of what I'm trying to talk about. All right, you can see here that the disc is intact, but it's sort of wandered into the space where the nerve sits. All right, there, can you see? It's putting pressure on the nerve. There. That's a bit of an extreme example, but it gives you an idea. So you can get degenerative discs that are basically spread and are encroaching on the nerve space. So what can you do about it? So they say to you, be careful, but you're not a surgical candidate, like I say. No, you know, they're not going to operate on you. So what do you do? Okay, maybe you've been to your physio and they've given you some exercises to do and it's not made any difference, or God forbid it's made it worse. So you may have experienced that therapist, physio, chiropractor, osteopath, whatever, okay, doctor, your PT, exercise you found online, however, you may have tried a few and they've said, yes, strengthen your core, and you've tried a few and it hasn't worked. All right, so then you're thinking, well, what else can I do? Trust me, you haven't tried everything. My last job, which I loved, was as an advanced physio practitioner. I've worked on my own in the private sector for a very long time, and then during COVID my business went, so I went back into the NHS because I really needed to experience that. I really wanted to, you know, test myself. I wanted to see if I could share some of the knowledge that I've learned over the way, and I really had a very, very positive experience, and it taught me a lot about how I am as a physio and how the rest of the system works. And you know, that's what I did. I was an advanced physio practitioner, basically because I'm old and I've been doing it a long time. Yeah, okay, I've got a master's degree, but it doesn't necessarily make you the best physio, all right? But it just makes you more learned, I suppose. Learned, whatever. And I used to see this all of the time, and there's so much more we can do. What these muscles should do when you train them, or not even necessarily train them, when you get them working effectively, is that they create that space to take pressure on your nerve, which I said earlier on. But there are so many ways in which you can do that, and you've got to think that everyday life movement is forwards and backwards, tipping side to side, twisting, loading, pushing, pulling, reaching up. It isn't just laid flat on your back. And whilst I give out exercise laid flat on your back, it might be that the exercise they gave you didn't translate into giving you enough support in your muscles when you're doing normal reaching, pushing, pulling things. So it might be that we needed to up the exercises, change the exercises, adapt the exercises. It could be that we needed to teach you maybe a better technique. I've talked about this in videos before. It could be that we need to change the pre-laid template in your nervous system that does things on automatic pilot. The biggest thing that you can do to improve your muscles and your pattern of movement is to feel what's happening in your body. So I spend a lot of time sharing people to say, take yourself out of here and really feel what's happening in your body. So when you lie down, are you aware that you're holding your breath? Are you aware that you're creating tension and bracing? Did you know that when you lift an arm or a leg that you can feel yourself tipping to one side? Therefore, you're not using those muscles very effectively. So there's so much more we can do, but that's that job, all right, is to protect, is to look after the nerves. Can we make degenerative discs be less degenerative? No, I'm not pretending we can't. We can't change the structure. But if you remember when I first started, I said that their job is to take the pressure off the nerve to provide stability. You absolutely 100% can improve that activity. All right, 100%. No matter how long you've had this problem, no matter what your age, no matter what you're going through, if you're like me in the menopause, it doesn't matter. But we may have to be more persistent. We may have to try a few things. We may have to take a bit of a different approach. We might have to include other stuff. We might have to look at balance. It might be that you're really brilliant at just pure lying down, move your arms and legs, but as soon as we put you on one foot, it goes awry, and then your muscles, instead of being able to work gently and nicely to support you, you create a brace because you're going to fall over. Okay, so therefore you're back to this bracing, tensing, putting pressure on the nerve, okay, because you can't hold yourself up. There's so many things. I could go on all day, probably all month about it, but there's so much more that you can do. So you owe it to yourself, okay, to start again and try again, and never give up. Never. One of my clients was telling me, which is so true, that that she just believed there's got to be something that you can do. There is, but you just have to find the right way for you. All right, and I feel so strongly about that if you have to hear this 100 times from me, I don't want you to give up. All right, I'm not going to give up on you, so I don't want you to give up on you either. Now, what I've done is I've created these sort of plans. They're not quite finished yet. I'll be heading towards finishing them soon, because I was thinking about what can I do if you were talking to me now and you were in that position where you'd had all these scans and kind of been left behind. What could I do to help? So I would say the first thing is to decide whether you feel comfortable to do an exercise laid on your mat, just gentle exercise every day or every other day. I've set them up to be every other day. Or whether you think, no, I prefer to do a little bit in standing, or whether you think, no, I prefer to do a little bit in sitting. So I think that's the first thing I would say to you, is to decide which would be the most comfortable position. And maybe the second thing is to take no notice of what other people are telling you to do, is to trust your instincts and think, right, do I think I just have backache, and actually I think I'm going to start with exercises there? Or can I tell when I'm walking around that actually, or people have told me that I lean to one side when I'm walking and I struggle. Yes, I've got back pain, but I also struggle to do too much on my legs. I find I tire easily, or my back aches the more I'm walking, or I find it difficult to go up and down the stairs because my legs don't seem to have the strength, but my back aches. Then maybe what I would suggest you do is we work down the road of strengthening your legs. But what I'm going to do, and you may be watching this video after I've already done it, but what I'm about to do is to record some videos, quick test videos, for you to try and work out where your starting point is. Okay, and so you could follow those. And if I've done them, I will put them in the links below. And if I haven't put them in the links below, please just email me or message me on social media, and I will sort it out. There was one other thing that came into my head then that's disappeared very quickly, and that happens to me a lot, and it's so frustrating because I'll probably remember the moment I've stopped recording this video, but it'll come back to me. So just make a start, just you know, make a decision, take some action and move on. It's come back to me, I knew it would. Is that you may find that it takes you several months to see a difference, and for so many of you watching this, this is a lifetime commitment to being more active. But you will find that you can move on and your exercises become more challenging. And you know, it's an ever increasing popular circle of positivity, because you will look back and think, wow, a month ago I couldn't do that. God, 3 months ago I couldn't walk this far or do these things. And honestly, you will find over time that it becomes not a chore. Well, mostly not a chore. All right. But you will get past that point of thinking I can't be asked, because you'll think, no, actually I feel so much better for doing it. And you will find that you can drop the easier exercises off and you can do more, and that's such a good feeling, that you will think very differently about it. But just please don't give up after a couple of weeks of doing them, because it's hard. It really can take quite a lot longer than that, and some of you will have to do a lot of groundwork first before you see any symptom change, and some of you will see symptom change quite quickly. But I can guarantee you one thing, right? You'll feel much more positive to doing something for yourself. It's time to take back control. Let me help you take back control.